Hello, members of Congress and classmates. I am here to talk about potential amendments to the False Claims Act. As with most United States legislation, the False Claims Act has a deep history of it. Amendments have been passed, penalties have been increased, and incentives have been proposed. However, the amount of healthcare fraud in the United States today should be considered a national crisis, and changes must be made. The FCA has strong amendments to consider when assessing potential ways to strengthen the legislation. And I'm going to get to those in just a minute. But first, I wanted to give you all a real-life example of healthcare fraud and how it impacted one United States citizen in a very negative way. The year is 2018, and Maria Zapata is going to see her doctor, Jorge Zamora Quezada. Maria has been a patient of Dr. Quezada for more than 5 years, being treated for pain in her knee, and he diagnosed her with arthritis. She was receiving injections from Dr. Quezada, who he told her that these injections would strengthen the cartilage in her knees. But as time went on, Maria noticed discoloration in her knees, and her primary care physicians became very concerned with the care that she was receiving from Dr. Quezada. After an assessment, her primary care physicians actually told her that she didn't have arthritis at all, and that she was receiving unnecessary injections that were ultimately harming her health. And as it turns out, this is not the only patient that Dr. Quezada was performing unnecessary procedures on. He was ultimately charged with conspiracy to commit healthcare fraud, 5 counts of healthcare fraud, and 1 count of conspiracy to commit money laundering. And according to the indictment, Dr. Quezada funded his extravagant lifestyle by treating patients with unnecessary procedures. He had a private jet, a Maserati with his initials on it. He had several homes, and this is certainly not an isolated incident of healthcare fraud in the United States. Healthcare fraud is tempting and sometimes an easy target for healthcare providers in the United States. They defraud the government of billions of dollars per year sometimes. Healthcare spending approximates to about $2.7 trillion per year, which is about 17% of the gross domestic product. And estimates project that fraud amounts to close to $98 billion per year, or 10% of the total Medicare and Medicaid budget. Punishments for healthcare fraud prosecuted under the False Claims Act have grown increasingly tougher, and there's been examples of providers submitting false claims and receiving up to 30 years in prison. However, fighting fraud is difficult due to the sheer volume of providers that participate in the Medicare and Medicaid network, and finding fraud is often like finding a needle in a haystack. So, what are the policy alternatives that I suggest? There are many strong alternatives to consider, but the two that I think are the most pertinent, the first is to allow government employees and employees whose job title includes fraud investigation to participate as whistleblowers and receive qui tam legislation. Currently, anybody whose job title includes fraud or is in a government employee, they're not allowed to participate in qui tam legislation. And ultimately, this allowing these individuals to participate in qui tam would reduce unnecessary litigation brought forth with qui tam lawsuits, because these individuals have a lot of resources at their hands to bring really strong cases of fraud to the government for investigation. So it would ultimately save the government money at the end of the day by reducing unnecessary litigation. The other proposal that I have is amending prompt pay laws. Currently, prompt pay laws require that insurance companies pay claims within 30 days of receipt, and penalties include a 2% interest payment on late claims. Other stipulations: insurance companies can only request additional information within 30 days of an electronic claim submission, 45 days for a written claim submission. And the law essentially violates insurers who fail to comply with these timely claims payments. The problem is that currently, on average, health insurance companies pay claims. 70% of claims are paid within 2 weeks of receipt. 99% are paid within 30 days. So there's really not a huge issue with insurance companies paying claims in a timely manner. So my proposal to the amendment of the prompt pay laws is to allow for a prepayment review team to be implemented with these insurance companies, extend the payment to 45 days, and require providers to submit medical records with the claims. Hopefully, the goal of this is to reduce fraud, error, and abuse losses by auditing claims and medical records prior to the payment, reduce investigative, legal, and administrative expenses by avoiding post-pay recoveries, educate providers through the denial of these abusive claims, and thus building awareness. But it will also strengthen provider relationships by reducing investigations on legitimate claims. And while both of these amendments are strong alternatives to enhance False Claims Act legislation, I think the prompt pay law modification is the most important and the most urgent that needs to be addressed. So the United States healthcare system is in a state of change. There's a new presidential run upon us in 2020, and the debate on healthcare continues. The False Claims Act, though, continues to be an important piece of legislation that provides the government legal authority to fight fraud. Healthcare fraud costs the United States government close to $60 billion annually, and to this day, we've only recovered $44 billion of that, and that should raise alarms throughout the country. The best and most efficient way to enhance the FCA legislation is to amend these prompt pay laws, implementing a prepayment review team nationwide, requiring health insurance companies to pay claims within 45 days, but allowing them to review medical records that providers bill to support the codes. And this will stop insurance companies from having to chase after providers, which has proven to be a difficult task, but it will also save the government billions of dollars related to healthcare fraud, waste, and abuse. Thank you all for your time today. I really appreciate it. And I really hope that we make some amendments to the False Claims Act before it's too late.